Welcome to the podcast. Michael Johnson here, acupuncturist, and today's exciting because we're going to be talking about erectile dysfunction, which does not get talked about enough. So, my name is Michael Johnson. Like I said, I've been practicing acupuncture for 15 years, and I've seen a lot of men's health issues. And one of the ones at the top of the list is erectile dysfunction. With me is Dr. May, an expert in the field, and I'll let him introduce himself.
Yeah, great. So yeah, I'm Dr. May. I'm a naturopathic physician, board certified in endocrinology, and like Mike, I've been practicing for 15 years as well. And for both of us, we both have a passion for men's health. We think that this is an underserved area of our demographics, and some of that's our guys. It's our own fault. We don't do a very good job of taking care of ourselves. So hopefully, some of the information that we can provide today and with future podcasts can kind of give you some updated information so that you can make better decisions about your health and be more proactive. Yeah.
Absolutely. And while we're talking about erectile dysfunction, like exactly what does that mean? Does that just mean you can't get an erection, or are there different definitions?
Yeah. So usually there are symptoms of erectile dysfunction, and that can be any combination of either trouble getting an erection, trouble maintaining an erection, reduced sexual desire, being able to get an erection sometimes, but not every time that you want to have sex, or being able to have an erection but not having it last long enough for sex, or being unable to get an erection at any time. So it can be any sort of iteration of any of those potential symptoms there. It's We don't have really great diagnostic tools for ED. Most of this is a clinical diagnosis, which means that it's based on symptoms. So when you go in, your doctor's going to ask you, all of these questions, and if you have a decent number of them, then it's likely you have erectile dysfunction. Now, you can go to a urologist and they can do some specific testing, like an ultrasound. One's called a nocturnal penile tumescence, which is basically measuring nighttime erections with special devices. It's funny, they used to do like a tape measure or a band-aid sort of approach, where basically they would wrap that around the base of the penis, and if it broke, through the night, or they would use stamps. And so they would wrap stamps around, and if the stamps broke through the middle of the night, then that told you that you were at least having an erection. Anyway, they've got better tools for that now. And then there's also an injection test where they inject your penis with a stimulant that increases blood flow and allows for an erection. And so again, those are kind of a little bit more invasive. So most guys don't jump to that, and most primary carers won't jump to that. So they'll base this strictly on clinical, questionnaires and things like that, and then make that decision, and then start treating and see if your erections actually improve.
That's interesting because it's like similar to our way of looking at things, of asking a lot of questions, figuring out exactly where that person is.
Mm.
And I'm glad you pointed out that it doesn't just have to be like can't get an erection, because that's what a lot of people.
Mm.
It's kind of a misnomer. It's like you hear erectile dysfunction, it's like you can't do it at all. That's it. And nobody, I
Mm.
won't say nobody, most people don't think of like, am I getting an erection that lasts long enough? Am I, happy? Is it a full erection? Is it the same as it was? And it ain't gonna be exactly the same as 20 years ago if you're older. But, is
Mm.
it, what level are we talking about here? And too many people think I'm not gonna talk to my doctor because,
Mm.
oh well, it's not actually erectile dysfunction. I can still have somewhat of an erection. I can still have somewhat of what I'm looking for. And people don't realize like
Yeah.
there's different levels. I mean, you definitely want to get help even when it's earlier on.
Absolutely. And so I tell guys this all the time, that your erections are a great litmus for so many different aspects of your health: your cardiovascular health, your neurological health, your psychological health. So if you start seeing changes in that erectile quality, it could be a first warning sign for other system failures there. And those are it's one of the more sensitive indicators for those other systems. Because you think about it, our cardiovascular system, for instance, you've got smaller blood vessels down there. So if those smaller blood vessels are starting to be affected by, let's say, plaque buildup, which is affecting your blood flow to that area, and you're starting to affect your erections, well, you have places where with other small blood vessels, like inside your heart, inside your kidneys, inside your brain. Like if
Hmm.
those are being affected, it's very likely those small blood vessels in other areas are being affected as well. And so again, this can be an early warning sign system for you.
Man, I'm glad you mentioned that. It's actually, you know what's coming. You already know what's coming if
Mhm.
you talk to me at all. But as far as organ systems affected in Chinese medicine, what do you think the main one is, Dr. May?
I'm just gonna ponder. It's probably kidney.
Yes, it is. You win. You get the gold star. But it's interesting
Right.
because kidney in Chinese medicine is not just kidneys; it's also reproductive. So a big part of reproduction is dealt with the kidneys because they look at the general essence and reproductive organs as also being part of that. So when you hear kidney in
Mhm.
Chinese medicine, don't think I'm having kidney failure. I need to go, freak out right now. You're also
Mhm.
talking reproduction. You're also talking, the brain to a certain extent. They look at the brain as part of the kidney function as well. All those base functions that are really important, and they
Mhm.
look at it, from that reproductive point of view. But you're also going to have the liver. The liver is a big part because in Chinese medicine, when you're super stressed and anxious, the organ that it affects is the
Mhm.
liver. And so when you look at more of the psychological parts of ED, which there are, because it's a cascade where it's like you get stressed about not getting an erection one time, and then the next time
Mhm.
you go into full anxiety mode of like, you know what, it didn't happen last time, it was embarrassing, I felt bad, and then you get in this cycle where
Mhm.
you get stressed and anxious, can't get an erection. The more you can't get an erection, you get more stressed and anxious. And so in Chinese
Yep.
medicine, that's the liver. And then also the heart.
Mhm.
People are always wondered back in the day, why did Chinese medicine include the heart when it comes to severe erectile dysfunction? And it's exactly what you just said. It's like, because there's a cardiovascular component that if you're having issues with your heart, it can affect a lot of different systems, including, your ability to get a good erection. So,
Mhm. Yeah, those are great points. And like I said, Chinese have been great observers for millennia now, and so they figured a lot of this stuff out before we had the tools to better assess these things. So
yeah.
before we jump too much into sort of causes of ED, let's talk about like how big of a problem this is to kind of give you guys more of a perspective on, is this something that, 1 out of 10 guys kind of deal with, or is it more or less than that? So let me share a few stats with you. So based on the study, it, it's indicated that somewhere between about 18 to 30 million men in America are dealing with some level of erectile dysfunction. And that's
Wow.
typically about 18.4% of men over the age of 20 in the US.
That's huge.
Now, yeah, that's a massive number. Age-related prevalence: about 26% of men younger than the age of 40 have ED. 40% of men at the age of 40 have it, and then 70% of men at the age of 70 have it. And there was this big study done on 8 different countries. The US was part of that. The US had by far the highest rate of erectile dysfunction at 22% in that
Hmm.
study. So we're seeing
Interesting.
some pretty significant numbers. And I can tell you, based on the number of men that I've seen over the years, rarely do I have a guy come in purely for erectile dysfunction. It's not
Yeah.
until you kind of prod and poke and ask these kind of questions do they actually start divulging. So we have to probably assume that these numbers are pretty conservative numbers and that they're likely much higher than what are being actually reported.
Yeah, that's
That's
my
my kind of
experience as
take on
well.
it. Mm.
Yeah,
Yeah.
that's my experience as well. It's like even when a guy comes in specifically for ED, sometimes they won't even mention it till the third or fourth visit. And
Mhm.
then finally, like we've spent 3 visits, they paid some money, are like, oh, and by the way, can you help with this? I've noticed, I can't keep an
Mhm.
erection as long as I would like to. And they always have this not always, but often have this embarrassed, like, I don't want to talk about this look. Why do you think there's a stigma around this? Like from your experience, why is this a stigma for men?
Yeah, that's a great question. I'm at a loss to some extent, just because erections for most men are really important. It's like we pay attention to that stuff. And for most guys, when you start poking and prodding and asking those questions, they know the answer to it. It's not like they're not aware of their erections or the change in quality. So it's like it's one of those things. Most of us are pretty hyper aware of it, but we're not talking
Mhm.
about it. And I don't know if it's to this, it goes back to this sort of stigma that, we just need to buck up and do more or do it better, or we need to solve these problems ourselves. And when it comes to this kind of stuff, it that just generally doesn't work out that way.
That's a good point. I wonder how much of it's societal as well. It's like one of the reasons we're doing
Mm,
that with this season, we're so focused and on the future, focused on men's health, I feel like, is that there is a stigma for a lot of men that they just don't feel like they can talk about their health problems for whatever reasons. I don't know if it's a societal reason, if it's just guys being
mm,
guys. I don't know what it is, but there's definitely that issue. And one of our passions here is like, okay, you can listen to this podcast and get something out of it to be able to help yourself. Because I've noted, I have no idea why. I'm sure societal is a part of it.
mhm.
I'm sure that at least 50 years ago, guys weren't supposed to talk about anything. My grandpa, he was in the Korean War. He didn't say a word about anything. I found out about it after he died
Mhm.
because he was just in that generation. And things are starting to change, but they're still like guys feel like almost that they're less manly if they talk about this stuff, which is not true.
Yeah,
But
yeah, yeah. You're right. I definitely see that in that older generation of men. I am seeing, I think, men in their 20s and 30s and kind of our age to kind of mid-ish 40s. I am seeing a bit of better sort of tendency to open up about those things, and it's not perfect by any stretch, but I do see a little difference or a swing of change there in some of the younger men, which I think is great.
yeah, and back to prevalence, I've noticed the same thing. A lot more guys struggle with some form of ED or some severity than
Mhm.
what you would think. Because in your head, you think, this is an old person problem, and it's not something that happens very often. If you wouldn't have told me a statistic, I would have been like, yeah, 5%. Maybe
Yeah.
10% total is what I would think.
Mm. Yeah.
So it's pretty shocking to see those numbers, and it's like, yeah, guys need to get help on this. Before we
Mhm.
move on, can I ask you a question? So
Sure.
you mentioned nighttime erections. Why is that important?
Yeah, so that's important because the process of erections is stimulated by a part of the nervous system that's called the parasympathetic nervous system, which is sort of that rest and digest aspect of the nervous system. So you actually have to be in a state of relaxation typically to have a good erection. So what better time for that than at nighttime while you're sleeping and you're resting? And
Mhm.
typically, most men during the night should have about 3 to 5 erections throughout the night, based
Hmm.
on what sort of stage of sleep that they're in. But often use that as a gauge for men, with this, talking about erectile dysfunction. And that, like, I asked them, do you often wake up with an erection, first thing in the morning? Most days out of the week. And if a guy tells me, oh, maybe once a week, once every couple of weeks, I will, then that's kind of a red flag for me. Like, all right, something is likely going on here. They're not
Yeah.
sleeping well. There's some major sleep disruption there. There's something else that's driving up stress hormones. Maybe their testosterone is low. Like, we'll go kind of go into some of those causes here in a little bit, but it's a great litmus or a great gauge for determining like how stressed you are. If you're super stressed, you're in that fight or flight mode a lot, especially like during sleep, then yeah, it's going to be really hard to have an erection, because think about it. Your body's trying to survive, right? And so it's using stress hormones like cortisol and adrenaline to help you run from the bear or whatever that stress is, right? So that's not an appropriate time to have an erection when you're trying to run from a bear. right?
It's true.
So it's part of that autonomic nervous system that is the balance between fight or flight versus that rest digest aspect.
Yeah, that's a problem if you're running from a bear. It's a major problem.
It'd be a little awkward.
The timing is bad, or giving a speech on stage, or something else that involves the sympathetic nervous
Ex-
system.
exactly. Yeah,
So
absolutely.
I'll hold off on the treatment part till we get there, but the parasympathetic,
Mhm.
I definitely want to come back to in regards to what we do. But before we get there, we can talk some about causes and stuff like
Yeah.
that if you like.
Yeah. So, top of the list for me is vascular issues. And this makes sense because this has to deal with blood flow to the penis. So, this could be everything from atherosclerosis, which is the hardening of the arteries, high blood pressure, high cholesterol, diabetes, heart disease. There was actually a study done, published in Circulation, which is a major cardiovascular publication back in 2018, and found that erectile dysfunction was significantly associated with increased risk of cardiovascular events, including heart
Hmm.
attacks, cardiac arrest, strokes, and heart failure. Now, the study looks at 1,900 men over 4 years and found that those who reported erectile dysfunction were twice as likely to experience one of those cardiovascular events than the men who didn't have erectile dysfunction.
Wow, that's significant.
Yeah,
I've never heard that.
that's that's very significant. So again, this is a very powerful first warning sign for your cardiovascular system.
Do you think people, if they are having erectile dysfunction and they can't find a cause, you think they should get their heart checked out just to make sure everything's good?
Absolutely, 100%. Yeah, you should go through a full vascular workup. So, get an ultrasound of your carotid blood vessels, get a coronary calcium score, do a treadmill stress test, like do all of those things that test your vascular system and see what they find. Because oftentimes, like that can be a big issue, and I'd say like that's one of those causes that's at the top of the list.
That's interesting because, from the Chinese medicine perspective, it's in the list, but I wouldn't say it's towards the top. And I think it's just because of
Mm,
maybe the kind of patients you see. Because I see a lot of, uh, when I was talking about the liver and stress. When you hear liver qi stagnation, that's synonymous
mhm,
with the sympathetic nervous system being constantly activated. You can't turn it off. It's just constant.
mhm,
That's one of the big things I'll see, but it's mainly just because of I think of the type of patients that are coming in to see me.
mhm,
I also see people with nerve damage. I've seen quite a few people with nerve damage in their lower back that affects their
mhm.
erections as well,
Yep.
cardiovascular effects, stuff like that.
Yeah. So yeah, you're right. Neurological wise, like this could be spinal cord injuries, any damage there at the base, the root nerves that innervate the penis, which are going to be in those lumbar sacral nerves. Stroke, Parkinson's disease, MS. Those are a few different conditions that can affect the neurological innervation to the penis.
Are there ever just
Mm.
unknown, like we don't know why, but you're just not getting erections?
Yeah, I mean, there's a few other causes. There's like the hormonal imbalances, so like low testosterone is another one that's high up the list. There are medications, and we know a few of these, like blood pressure medications, certain antidepressants, certain anti-androgens that are used for like prostate cancer. Even some ulcer medications can cause some issues. Nutrient deficiencies can kind of lead into this too to some
Hmm.
extent. Like folic acid is one that's been heavily studied. And that one, there are a lot of good studies on folic acid and not having enough of it correlated to erectile dysfunction. We don't really know as far as causation, like how it relates to that, but we know that there's a pretty strong correlation there. And that's part of like the whole nitric oxide pathway. So nitric
Mhm.
oxide is that pathway that helps to dilate blood vessels. So it's kind of one of the big triggers for an erection. And so if that cascade is not working because you're deficient in certain nutrients like folic acid, L-arginine, L-citrulline, those are a couple amino acids that stimulate that. Then obviously it's going to affect your vascular system and your ability to dilate those smaller blood vessels. So That's other causes there. You got lifestyle factors, so like smoking, excessive alcohol use, being too sedentary, being overweight or obese. Like a lot of like, especially when you got a lot of visceral fat, and that's actually creating some pelvic congestion. So it's putting pressure on all those blood vessels there in your pelvis, which can affect circulation to the penis as well. So losing some weight, taking some pressure off of those areas. Don't sit as much because that can do it too, like just creating that pelvic congestion. Um, let's see what else. Prolonged bicycling. I've seen this a few times in guys who are like athletes that are, doing competitive cycling. Just that pressure on the nerves there, you can get nerve damage to those
Hmm.
perineal nerves. Um,
I've
Peyronie's
seen that.
disease, which is where there's scar tissue that develops in the penis, and this is where guys get like a significant curvature in the penis, and which makes it difficult for a full erection and then intercourse, with that.